So what do you see here? You see here the midbrain. So the midbrain is about 0.8 inches in length, and it connects the pons and the cerebellum with the forebrain. The long axis of the midbrain is going to incline anteriorly as it is going to extend through the opening in the tentorium cerebelli. So that is something very important which you have to remember. Midbrain is traversed by a narrow channel which is a cerebral aqueduct which is going to be filled with CSF or the cerebrospinal fluid. Now let's talk about the posterior. On the posterior surface, we are going to see four colliculi which are corpora quadrigemina. They are round eminences that are going to be divided into superior and inferior pairs by a vertical and a transverse groove. Superior colliculi are centers for the visual reflexes and inferior colliculi are for the lower auditory centers. In the midline between the inferior colliculi, the trochlear nerve is going to emerge, or the fourth cranial nerve is going to emerge below the inferior colliculi in the midline. These are small diameter nerves that wind around the lateral aspect of the midbrain in order to enter the lateral wall of the cavernous sinus. On the lateral aspect of the midbrain, we are going to see something really important, which are the brachia. So the superior brachium is going to pass from the superior colliculus towards the lateral geniculate body, SL, and the inferior colliculus is going to enter the medial geniculate body through the inferior colliculus. A little about the anterior aspect of the midbrain. So anteriorly, we are going to see a depression in the middle, which is the interpeduncular fossa. On either side of this depression is the crus cerebri. Many small blood vessels will perforate the floor of the interpeduncular fossa. So this region is going to be called the posterior perforated substance. The oculomotor nerve is going to emerge from a groove on the medial side of the crus cerebri, and it is going to pass forwards in the lateral wall of the cavernous sinus. Let's talk about the levels of the midbrain. So the first level is that of the inferior colliculus, and the second level is that of the superior colliculus. The cavity is going to be same for both, which is the cerebral aqueduct. Okay, now let's talk about the nuclei. So for the nuclei of the inferior colliculus, I want you to remember Snapchat. So here you can see the logo of Snapchat. And for S, I want you to remember substantia nigra, and for C, colliculus. So inferior colliculus here, and then inferior colliculus 4-5, or the fourth cranial nerve nucleus. This is the trochlear nerve nucleus and the nucleus of the fifth cranial nerve, specifically the mesenceptic nucleus. Okay, for the inferior colliculus nuclei, I want you to remember Snapchat again, but here this time I want you to remember some different numbers or different IDs of the Snapchat, which are 3 and 5. For S for the substantia nigra, C for the superior colliculus, 3 for oculomotor nucleus, 5 for the nucleus of trigeminal nerve, and specifically the mesenceptic nucleus. So here the Snapchat ghost is going to enter the emergency room or the ER. So E for the Ettinger-Westphal nucleus and R for the red nucleus. Now let's talk about the sensory tracts of the inferior colliculus. So first of all, we're going to have something that starts with an L, and then we are going to have a D consonation or something that starts with a D. So for the L, or for the lemnisci, I want you to remember SLMT, which is the spinal lateral medial and trigeminal lemnisci, and for D, I want you to remember the D consonation of the superior cerebellar peduncles. Now let's talk about the sensory tracts of the superior colliculus. So superior colliculus is going to have only lemnisci, and specifically the STM lemnisci, or the lateral lemnisci is not going to be present at the level of superior colliculus. Now let's talk about the motor tracts. So for the motor tract at the level of inferior colliculus, I want you to remember CCTV camera and FM radio. C for corticospinal tract, C for corticonuclear tract, T for the temporopontine, and F for the frontopontine, and M is for the medial longitudinal fasciculus. Similar thing is going to happen for the superior colliculus with an addition of decusation of the rubrospinal tract. Okay guys, so please draw the midbrain with me, which is at the level of the inferior colliculus. So for that, we are going to interestingly draw a frog. Now see me draw a frog. So basically this is a frog. Alright, and it has 3 legs. I'm gonna make like 3 partitions here somehow. Alright, and now this is its eyes, and of course it has a nose. Also, it also has legs, and it also has 2 hands. Along with that, it also has some sort of a deposition. And something is going to be present with this particular formation. Plus here. Perfect. So this right here is the inferior colliculus. This is the medial longitudinal fasciculus. This is the cerebral aqueduct. And this is the mesenceptic nucleus of the fifth cranial nerve. And this is the nucleus of the trochlear nerve. This is the medial longitudinal fasciculus. This is the lateral lemnisci. This is the trigeminal lemnisci. This is the spinal lemnisci, and this is the medial lemnisci. This is the decussation at the level of the superior cerebellar peduncle. This is the interpeduncular fossa, and this is the substantia nigra. This colored area is the reticular formation. These are the frontopontine fibers. These are the temporopontine fibers, and in the middle we have the corticospinal and corticonuclear fibers. This is the crus cerebri, the tegmentum, and this is the tectum. Please draw the midbrain with me at the level of the superior colliculus. So now let's make a frog again. Of course. Now let's label all of this. This is the substantia nigra, of course. So what do we see here? Here we see the superior colliculus. And here we can see the lemnisci, which are going to be at the level of T, S, and M, which means trigeminal, spinal, and medial lemnisci. And what do we see here? We see here the red nucleus. And here is the decussation of the rubrospinal tract. And this is the oculomotor nerve. And this is the nucleus of the oculomotor nerve. This is the pigmented part, or substantia nigra. Its arms are basically medial longitudinal fasciculus. This is the mesenceptic nucleus of the trigeminal nerve. And this is the cerebral aqueduct. And the cerebral gray matter is also present. Okay. And here what do we see? We see frontopontine fibers. and corticospinal and corticonuclear fibers. Also, we also see temporopontine fibers.